Hello and welcome to the InMotion video series, brought to you by Motor Trades Care. This newly created video series will consist of periodic release of short topical videos aimed to inform and educate PCBUs and employees on work health and safety and injury management matters within the automotive industry. Today, in our first InMotion video, we will be discussing manual handling and related to the automotive industry. Within the automotive industry, tasks that involve manual handling are most commonly identified within workshop and parts storage environments. This exposure to manual handling increases the potential risk for sustaining musculoskeletal injuries. Musculoskeletal injuries can affect employees at any age, with significant injuries potentially impacting employees for the entirety of their career and life. These consequences include extended time off work, decreased productivity, and the reduced ability for injured workers to complete their normal job role. This can also lead to the possible increase of workload on the rest of the team, thus putting them at greater risk of injury. In this InMotion, we will elaborate on the musculoskeletal system, musculoskeletal disorders, what makes manual handling hazardous, strategies that can minimize the risk of manual handling injuries, some manual handling tips, and the benefits of overall well-being. Let's look at the musculoskeletal system and how it can be affected by manual handling. The musculoskeletal system not only includes muscles and skeleton, but also includes connective and supporting tissues such as ligaments, tendons, cartilage, nerves, and joints. Undertaking manual handling tasks can damage the musculoskeletal system, resulting in musculoskeletal disorder. Musculoskeletal disorders are identified as injuries or pain affecting the musculoskeletal system. Some examples are muscle strains, sprains, and fractures. While manual handling injuries can be minor or usually resolved within weeks or months, some can cause significant and at times irreversible damage to the system. So, what is manual handling? Manual handling is any activity that requires someone to use physical force to lift, lower, push, pull, carry, move, or restrain any person, animal, or thing. Manual handling may present as hazardous manual tasks when the activity involves one or more of the following: repetitive or sustained force, high or sudden force, repetitive movement, sustained or awkward posture, or exposure to vibration. Examples of hazardous manual tasks include repetitive lifting of wheels or boxes of parts, prolonged work over a bonnet or under the dashboard, and using power tools such as a rattle gun with high levels of vibration. Manual handling has the potential risk to result in an injury. When we take into consideration the component to classify it as a hazardous manual task, and potential risks may increase through consistent exposure. Considering this, how can we mitigate potential risks resulting in manual handling injuries? Organizations should aim to eliminate the need for manual handling tasks, especially hazardous manual tasks. However, this is not always possible. In these circumstances, employers should minimize the risks associated with manual handling to as low as reasonably practicable. Organizations can achieve this by following 3 simplified steps. First, review manual handling tasks and assess the risk to determine if the task can be eliminated, by including in your assessment whether the tasks are considered hazardous. Consider which tasks pose the greatest risk of injury. Where tasks cannot be eliminated, consult with employers who undertake the relevant tasks to determine strategies to minimize the associated risks. Refer to the hierarchy of control when determining appropriate control measures. Hierarchy of control is a step-by-step approach to eliminating or otherwise reducing risks, as it ranks risk controls from the highest level of protection and reliability to the lowest and least reliable protection. Providing the right tools, equipment, education, and training are some of the key strategies organizations can adopt to minimize the risk to employees sustaining a significant manual handling injury. Lastly, implement appropriate strategies or a combination of strategies to minimize the risk to your employees. An example to mitigate a manual handling risk could include lifting aids to raise, lower, and move wheels to and from vehicles and equipment. This could be to minimize risk exposure to carrying or otherwise rolling wheels. Now, let's look at some physical lifting mechanics that you can share with your employees. Did you know there is no legislated limitation on the amount of weight a person is allowed to lift at work? This is because each person is individual and will therefore have different lifting capabilities. The diagram shown is a generalization of capability and fitness to lift weights by the average individual. The diagram highlights examples of the weight adjustments required depending on the height, build, and stature of the individual and the item that is to be lifted, as well as the distance of the item from the body. Storing heavier items on higher or lower levels should be avoided as the weight we lift in these ranges are naturally lower. Lifting heavy items above shoulder height or below knee height increases the load on the spine and therefore increasing the risk of injury. We will conclude this video with a brief overview of some fitness for work advice. To ensure employees stay fit for work, it is important that they care for their health and well-being. This includes eating a nutritious, well-balanced diet, exercising regularly to maintain strength and fitness, having sufficient good quality sleep, good mental health, maintaining adequate hydration, and minimizing alcohol intake. Additionally, employees who have physically demanding job roles should participate in regular exercise. This to support strengthening of muscles used, maintaining cardiovascular health, and improving mental well-being. Maintaining good physical condition is paramount to ensuring that employees are fit and capable for the undertaking. As an example, a rugby player is required to maintain and improve conditioning through physical training in between games. This is to ensure optimal performance and minimizing risk to sustaining injuries during gameplay. Some suggestions for encouraging employees to improve their well-being while at work include warming up muscles prior to the task. This is to ensure the muscles they use are ready to perform manual handling tasks. Hydration, being adequately hydrated, is essential for the musculoskeletal system to function effectively. And wearing supportive footwear. Having the right footwear is important for your posture, especially for jobs that require prolonged standing. If you need help or support with improving work health and safety in your business, or interested to know more about the Motor Trades Care and how we can assist your business to meet safety needs, please do not hesitate to contact us. You can call us on 1300 006 826. Alternatively, send us an email at inquiries@motortradescare.com.au or visit our website motortradescare.com.au. Thank you for watching. We hope you found this InMotion video to be informative and useful.